Welcome to Recovery Equity, a series of conversations about how we can reach and help more people find freedom from addiction. This is a space for us to reflect on some hard truths and to consider ways forward and even new possibilities. I'm Quyen Ngo, and I'm a clinical psychologist by training and a licensed clinical psychologist at that. But right now, I primarily lead research with the Hazelden Betty Ford Foundation.
And I am Randi Tolliver, a master trainer consultant for Hazelden's Professional Education and Continuum Solutions Division. I hold a doctorate in clinical psychology, but I am not currently practicing. I work as a trainer consultant, providing support to behavioral health and medical providers seeking to improve their practices, especially as they relate to integration of services and ways to serve the entire person and the communities in which they live and work. Today, Quyen and I will be laying the groundwork for this new Recovery Equity series hosted by Hazelden that will include a host of guest interviewees. We hope today's conversation and the ones to follow will reach a wide audience, including people of color in recovery, family members impacted by recovery, service providers, and any other allies who are interested in promoting recovery equity. Based on these conversations, we hope you and others will be touched by something said, connect to this experience. We hope you will be heard, be seen, and find space and courage to develop better connections with those you meet. And we hope you join our conversations and Hazelden's commitment to learn together, listen openly, appreciate cultural and community diversity, amplify unheard voices, think differently, challenge the status quo, and take action to affect change. Today, we are pleased to introduce to you topics that are close to our hearts through a process of reflections around recovery and recovery equity. What is recovery equity? It's a newer term, and in some ways, it's still being defined. But by recovery equity, we mean kind of two things. One, the ability to access treatment and recovery services that are culturally informed and responsive. And two, receive the support needed to find healing and the freedom from substance use and mental health disorders in order to maintain well-being for individuals, families, and communities. So there are two big points in that definition: the ability to access and the ability to receive. And this is a term that we will spend more time in the next episode.
That's right, Randi. And, I think we want to acknowledge that, first of all, addiction treatment can be hard to access for anyone. Just generally, treatment of addiction and recovery resources can be hard for everyone. But why have these conversations now about recovery equity? What led to these? And, I'm broadcasting from the Twin Cities area in Minnesota. And so for me, we can't have these conversations without acknowledging what happened in the summer of 2020 here with the murder of George Floyd. So recovery equity is about access for everyone and the unequal access to treatment and recovery resources for people. But for me, we're starting here from that point. That has really propelled this conversation forward. So with the murder of George Floyd and the social unrest that happened here in the Twin Cities, we're going to start these conversations looking at our Black African-American community here in the United States and the challenges that there are in accessing treatment and accessing resources for recovery and accessing culturally appropriate treatment as well. So that's where we're starting, but we're not ending there. So Randi, I don't know if you have anything to add to that, but that's where I want to start the conversation.
No, I think that's great. I was going to say, I'm not a resident of Minnesota, but I was also impacted, not just as an African-American woman, but because for the last couple of years, I've served as the Hazelden lead for a grant through the Minnesota Department of Human Services that's designed to address racial disparities related to opioid deaths within the African-American community. And working with the African-American treatment and recovery communities in Minnesota and their allies has confirmed, Quyen, and reinforced the need for both providers and communities to receive a number of things. One, increased education and training to better understand the effects of historical trauma and substance use and mental health. Two, the importance of advocacy and inclusion of African Americans at decision-making tables. And three, the value, again, of seeing ourselves where we are served and recovered. And that is that means to me, really having African American service providers and peer support specialists in places where we work and live. And I was thinking about the importance of this kind of seeing ourselves being around individuals who are similar to us, and the importance of that safety and support for Blacks or African Americans and people of color when they may not be in a diverse environment. And that's not to say that safety and support is needed for everyone when their environment lacks diversity, but I have known many that crave the support and safety found by connecting with their Black colleagues or colleagues of color. And then I was thinking the other day about how in some ways this safety and support is very similar to the relationships and social network needs of the substance use recovering community. And we support the coming together and communing of recovery communities. And how does that look for people of color and their needs to address stigma and discrimination, to be seen, heard, and supported?
That's right. It is so much about making that connection with other people. And some of that is, seeing people who look like you, connecting with people who look like you. There is that instant connection, whether you're blonde or brown haired or, whatever you may be, seeing someone who looks similar to you helps to frame your understanding of that. And I think what you're saying about providers in our system who reflect the people that we are trying to serve is incredibly important, because we don't always realize the different ways that we may say things that offend other people or that hurt other people. And it's not coming from a place of malice. It's not, we're not talking about a bunch of really awful, terrible people. We're talking about just that disconnect that there can be if you haven't been around a specific group or been exposed to a specific culture or had those connections before. So I think it's really important to have that diversity. It comes out in these small ways, for example, in our own system, where I heard a story from one of our providers that they were working with a patient who was African American and moving from a day treatment program into our residential program, so increasing the care that they needed. And another staff person, the patient happened to be Black, and another staff person who was white said, "Oh, I didn't know that we were taking Medicaid now. That's so great that you get to move into residential." And that assumption there, it was meant to be a kindness. Obviously, I'm glad you could get to residential, but that assumption that as a Black patient, you couldn't afford residential without Medicaid or that you didn't have employer provided insurance, that was noted by both the patient and the care provider who was Black as well. So those small things, again, not with malice, but so impactful and really reflects those little interactions that our patients can have, our clients can have when they move through our system, and we don't even realize they're there. That's why it's so important to have these diverse voices to raise issues like this.
I was thinking also, when I think of our role on our team as educators and trainers, we've also found that it's important to bring that topic of culture to the table. And so as we're preparing our work for our customers, it's important for us to understand what they want their employees to learn, and also how they learn, and the cultural context within which their services are provided. So for example, when I've worked with white providers who are serving clients of color, I will ask how they address certain matters such as engagement, communication styles, involvement of faith. It's a meaningful conversation we have about the potential impact culture may have on the challenges faced by their clients or our customers. So we have to consider what factors, as you were saying, or experiences may prohibit a group of individuals from feeling comfortable with what may be a really good opportunity or service for them. So going into a substance use or recovery provider. But I also think we're starting to see some of some elements of this need to understand culture, historical experience, and individual needs during the rollout of the COVID-19 vaccinations. Mm-hmm. African Americans are really reticent about the safety of the vaccine for them. And this hesitation is not new, but it seems to be highlighted now because of the significant focus on the vaccines. So it was present years ago when we noted, all of this was present years ago when we noted the higher rates of undiagnosed or unmanaged physical health and behavioral health concerns for African Americans. And, in reality, some of these matters are not even unique to people of color, or in this situation, African Americans. In some ways, what we really want to focus on is that we see people for the completeness of who they are and dismiss certain aspects of them because we either don't see them, recognize them, feel comfortable with them, or even because we dislike those aspects of them. So therefore, it's important for us to maintain a cultural awareness for everyone with whom we come into contact. That is defined cultural awareness, that we are cognizant, observant, and conscious of similarities and differences among and between cultural groups. And I did want to say, Quyen, you kind of brought up the concept of language, and language matters. The words we use matters. Mm-hmm. I've heard it said before that we are not kind of neutral beings, that we're either moving toward or away. We're encouraging or discouraging. That's a good place to see kind of how language influences us, especially when we're talking about the use of stigmatizing or non-stigmatizing language. So, for example, using the term an individual who uses substances or having a substance use disorder versus an addict or an alcoholic. And it's important because research has found that exposure to some terms may induce systemic cognitive biases that may then affect our clinical judgments and the quality of care that a person receives. So that research also indicated that when the term substance abuser was used, the listener felt the substance abuser was less likely to benefit from treatment, more likely to benefit from punishment, and more likely to be socially threatening. So our words matter, and our words influence how people think. Quite simply, it's important to watch our words.
Yeah, absolutely. And I love what you said about the completeness of who we are, because it impacts everything. You brought up research. Absolutely. The research shows that, in particular, Black people in America, Latinx people in America are less likely to seek treatment for addiction. And in addition to that, there's the complicating fact of gender and race. So, women of color are more likely to access addiction treatment than men of color. These are all things that are really important to understand. And having that component of a completeness of person is incredibly important for that representation in research too. So we've talked about, in treatment and in recovery services, but in research too. Most of the research that we've conducted has really been focused not on marginalized communities. Individuals with addiction, are marginalized in many ways, but when they're compounded by additional identities that marginalize individuals, the understanding around that is also really lacking. So in many ways, our understanding of recovery and our understanding of addiction treatment is missing components because we don't have the wholeness of person there, and we don't have equal representation across different marginalized identities. And until we have those components in research, then we can't truly understand addiction or recovery. We just understand a sliver of it. So I really love what you're saying with that.
Quyen, and I know we're coming up to the end of our time. And I think a lot of what we've talked about really speaks to the need for providers, but everyone to really recognize the unique challenges to treatment that are faced by people of color, and that there's something we can do differently. And that is, so for us to build and foster recovery equity through new ways of thinking, new practices, and new policies that include multiple groups and that positively impact structural change. And the good thing is that some of our future episodes of Recovery Equity series will include more about what providers and allies can do differently. So, well, Quyen, we've covered a lot. And based on these conversations, to our audience, we hope that you have been touched by something said, have connected to this experience, been heard, been seen, and found a space to encourage others and yourself to connect as you meet them. The next episodes, as I mentioned, will include another conversation with Quyen and me on recovery equity, privilege, intersectionality, and the impact of trauma. And then additional episodes will include guests such as Dr. Rashida Fisher, who will address adverse childhood experiences or ACEs, brain development and the long-term effect of trauma on youth and communities of color, cultural competence, and one of my favorites, cultural humility. We'll also have Mr. Andre Johnson, who will discuss experiences in the Black community, stigma, and matters of treatment and recovery related to substance use disorders and mental health disorders, as well as the power of peer support specialists. And Dr. Peter Hayden, who will discuss how to create a culture to effectively engage and treat individuals in the Black community.
Right. And I want to just reinforce here too that we are starting with the Black community, but this is going to be an entire series that's focused on recovery equity from many marginalized identities. So we're not just talking about race and ethnicity. We will be talking about gender. We'll be talking about urban versus rural access to care as well. So this is really about recovery equity as a whole. And we're here at the very beginning of this now.
So thank you for taking the time to join Quyen and me as we introduce the Recovery Equity series. We hope this conversation about recovery issues and challenges for the Black community and the conversations to come provide you with things to think about as you move through the remainder of your day and interact with others.
And to everyone out there, please let your friends and colleagues know about these conversations and come back often to catch more episodes on recovery equity. Together, we can build a healthier, happier, and more equitable tomorrow.